Namaste, I'm Dr. Suraj Subhash. In today's video, we will be discussing on the topic back pain and its Ayurvedic management. Back pain is a problem that affects the people, millions of the people across the globe. And I'm sure that most of us might have experienced back pain at one or the other point of the life. It is estimated that 80% of the population will or might experience the back pain at one or the other point of their lifetime. The back pain can range from mild discomfort to severe debilitating conditions that can usually or significantly affect a person's day-to-day life and thus affecting the quality of life. It can cause the persons to have difficulty to get up from their bed or to walk or even to sit for a prolonged amount of time. For some persons, it may start with a dull ache and it might even extend to a severe or sharp shooting pain across their legs. The intensity and the location of the pain can also differ according to the cause of the back pain. Let us now understand what are the different causes of back pain. The cause of back pain can broadly be classified into mechanical issues and medical conditions. Mechanical issues usually include muscle or ligament strain. There are different reasons why a person's ligament can get strained. For example, a person who lifts heavy objects or sudden jerky movements can definitely cause a strain in the ligament or muscles, thereby causing severe pain to the back. Poor posture is one of the major other factors that can cause a severe back pain. The posture while we sit, sleep, or stand, and if the posture is not a proper one, can definitely lead to strain in the muscles and the ligaments, thereby leading to back pain. The other major cause is the medical causes. The medical causes includes degenerative conditions, herniated discs, fractures, irregularities in the spine, and inflammatory conditions. Among the medical causes, degenerative diseases are one of the most important causes that can lead to back pain. When we say degenerative diseases, it can affect two aspects or it can affect two parts. One is the degenerative conditions of the joints, and the other one is the degeneration of the disc. Now, when the joints are getting degenerated, that is usually caused due to the age-related wear and tear, which leads to the degeneration of the spine, thereby leading to pain and numbness. Apart from that, the other structure that can undergo degeneration is the disc. Discs are soft, cushiony structures that are located in between the vertebrae. And when these undergo degeneration, they lose the ability to flex and also the cushioning effect, thereby leading to numbness and pain. Apart from that, the joints, smaller joints between the vertebrae also can undergo degeneration, and that also can lead to severe pain and stiffness. Another commonest medical cause for the back pain is disc bulge. As I mentioned earlier, disc is a soft cushiony structure that is located in between the vertebrae. Due to mechanical causes or due to trauma or due to the different activities done by the person, these discs tend to slip out of its place or can undergo an inflammation. And once it is undergoing an inflammation or it slips out of its place, it exerts a pressure on the nerve roots and thereby leading to severe back pain and stiffness of that region. Injuries to the spine and fractures also can cause severe back pain, and which is usually caused due to a trauma or an accident. Apart from this, inflammatory conditions such as ankylosing spondylitis that causes the vertebrae to fuse together is also considered to be one of the major factors for the cause of back pain. Sedentary lifestyle is at another cause of back pain where a person tends to have very less activities that overdue in the time causes the stiffness of the muscles. And apart from that, obesity and smoking is also said to cause back pain. Sometimes some persons can also experience back pain due to severe stress. It is said that stress can lead to severe muscle tension, ultimately leading to back pain. Let us now understand how Ayurveda views back pain and what approaches do we take in order to manage the back pain. According to Ayurveda, back pain is considered under the two headings, that is Katigraha or Gridrasi. The Katigraha usually refers to the pain and stiffness pertaining to the lower back, whereas Gridrasi pertains to the pain and stiffness to the lower back, and that has a radiating kind of nature to the lower limbs. Whatever might be the condition, the physician usually analyzes the patient, understands his or her prakriti of the patient, and also the vikriti. Vikriti is usually the imbalance of the doshas, and the physician understands the imbalance of the doshas in the patients and then focus on balancing the doshas in order to cure the conditions. So the Ayurveda treatment mainly focuses on balancing the doshas, the tissue repair and regeneration, of course, reduction of digestion and metabolism, and also in the reduction of stress. So while balancing the doshas, the usual doshas that can undergo the vitiation in case of back pain is Vata and Kapha, and also the combination of Vata Kapha. So they adopt treatments that can balance these doshas. Both externally and internal medications are used to attain the balance of the doshas. Apart from that, Ayurvedic treatments also focuses on the tissue regeneration and strengthening, wherein the focus is usually given to the muscles and the ligaments around the vertebrae in order to strengthen the lower back so that the persons have a good spinal health. There is a focus on the digestion and the metabolism part, and it is usually seen that persons suffering from lower back pain or chronic lower back pain can ultimately ultimately have constipation as a complication, and vice versa. Hence, it is also important that the digestive and the metabolism aspect is also corrected while undergoing the treatments. Stress can also exacerbate back pain. Hence, while doing the treatment, focus is also given in the reduction of stress. The different techniques that are used in Ayurveda to treat back pain includes Panchakarma. Panchakarma are the various 5 detoxification therapies that includes Vamana, Virechana, Nasya, Vasti and Raktamokshana. And the most commonest Panchakarmas that are used in back pain cases are Vasti and Virechana. Apart from the Panchakarma treatments, treatments such as Abhyanga, Snehana, Piju, Kadivasti are all adapted in order to regain the spinal health. Ayurveda also focuses on the different lifestyle modifications in order to attain or in order to sustain the results of the Ayurveda treatments. The lifestyle modifications usually include advising the regular exercises to the patient suffering from back pain. For example, gentle yoga postures, walking or swimming can usually help the patients suffering from back pain. Apart from that, proper postures are advised while sleeping, sitting or standing so that the person can have a proper spine. The lifestyle modifications also includes the weight management. A person who is overweight always tends to have a lower back pain. Hence, measurements in order to manage the weight is always advised. Dietary modifications are also advised by the doctors because certain foods can increase the vata in the body, and hence those foods are usually to be avoided by the patient. Apart from this, techniques like meditation and yoga in order to help reduce the stress is advised. It is always important to consult an Ayurvedic physician before one gets a treatment. Consulting an Ayurvedic physician can get a personalized treatment plan, and Ayurvedic treatments are always an effective way to manage the back pain. Thank you.